honored to introduce Permanent Secretary of the Ministry of Health, Medical Services, and his team the inquiry today by the Public Accounts Committee into the 2026 Appropriation Bill 2025. Permanent Secretary, this process is not new to you and your team. Most of you have been part of this process in the past, and we are back again for this another inquiry for the 2026 Appropriation Bill 2025. We have with us the proposal that I think has been accepted by the Ministry of Finance to be included in the bill for a total of sorry,
about
852 million.
Yeah.
A total of 852 million in both recurrent and development expenditure for next year, 2026. What are the procedures and the processes that are involved in this hearing? You need not to be reminded about it. For now, I just want to welcome you and your team to this inquiry. Let me just take you to show some of the figurative, quantitative analysis that have been made on your allocation. For this year, we want to run this inquiry in a more efficient way. Possibly there will be questions to you by members of the committee. We might be asking you just one or two questions, just to pick your thinking for the head of the department. But what do you think about, the theme, and also looking forward into 2026? What are your priorities immediately? Obviously, you mean as I doing everything. That will be a real difficulty, because we all know what are the constraints that you may be faced with. But it would be just to pick on one or two things no more, and get some ideas from you no more, and then we will conclude. In terms of the trend analysis, I think so far, over tracking it over a period of 4 years, it remains steady for the last 3 years, or 5 years, sorry. 3 years beginning from 2022, it remained stable. I think understandably, the situation at that time. But last year, it picked up from 2024, and then next year, it has gone up in terms of quantum that has been allocated to your ministry in aggregate, both recurrent and development. So that is a good news for you here, PS. On the year-on-year growth, we've seen the trend. For instance, starting off in 2022 to 2023, it's sort of basically zero, below 1%, up till about 23 to 25, I think, because of the COVID situation. So it was really down at the negative range. But from 2024 to last year to this year, it has picked up quite considerably by some 41%. Yeah, 41%. And then now it drops to almost about 14.5%. That is quite worrying to us, like that, yeah? The overall aggregate, scenario of the kind of allocation. It shows there could be some issues, and this would be of interest to the member for West Quarai, who is the chairman of the Select Committee on Health and Medical Services. I don't know why we have seen a sudden drop, from last year until now. Maybe you can give us some explanation on that. When I say year on year, comparison of, from a year to what is being allocated now, it seems to be dropping. I don't know why that trend has come about, but that would be a real worrying factor for us. Why we would continue to have that? Is that simply because you weren't putting up your hands up high for them to see your hand up and then agree to your proposal? Because you must continue to have a stable or at least an increasing trend in the way that the allocations are made. I don't know why this has been the situation. I understand the Brigadier General on the why the figures have ended up like that, but possibly you will be in a better position to show that to us. In terms of the establishment, some good indication. Positions have been created. It has gone up. But I think there are some differences to what has actually been filled. I'm not too sure whether that is the real reason as to why there seems to be a lack of interest in putting in resources to the positions that have not been filled and therefore they have been frozen. I'm not sure whether that would be the case. Others will ask you some significant changes in the movement in the recurrent budget, but I think it is always good to see that there's a positive trend, in the movement to some of the most very significant ones that have been shown in here. Others will want to ask some questions on those peers. There might be some questions asked to you on the issues of doctors that we have. Questions have been asked in other areas of specializations in the National Referral Hospital, believe me, and also throughout the country. And what have we done? Are we proactive about it to put our proposal? And I don't think we should in some way put a pause here or skip some years. We must continue to put our proposal and bid for space in scholarship, especially in that field. In other aspects of within the service and the sector, I'm sure that it will equally apply to them as well too, I must say. But what we want to say to you is that we want to encourage you in the health sector that you must continue to keep your focus on resourcing, because the last thing that you may need for is descriptions like people always say to us that we have a crippling health system, under-resourced, all of that. So let us respond to them. So now lo that. One very significant observation, Noma, that I just want to bring to your attention about is that very recently, last year, we've asked Ministry of Finance, and they've come up with some kind of a modeling proposition, and we understand that it has been featured in the fiscal strategy for this year on the ratio combination between recurrent spending and development in relation to the overall budget below the sector. And now their recommendation is for some kind of 80 to 20% ratio, 80% on the recurrent and 20% on development, like that. This morning when we asked them, it is not quite implemented in this budget, but that's the kind of thinking going forward, that if in 2020, possibly next year, there might be some adjustments made to the budget, but I'm not sure whether that is going to be a viable proposition that they are going to pursue. But just look normal Ivallo there, PS. Something like 8-something%. Yeah, something like 8.1. Something like 8.1% on development, and then 91 or something like that, long or recurrent. So recurrent takes up more of the spending, development and lesser. So this kind of a ratio expression long budget itself, it shows we're not the focus blue management. You know what I mean? Yeah, when it's the focus of the management, we should be more on the development aspects of our health services at all levels, going forward. So it would be interesting, to find your reaction to that. What can be done next year? Is that something that you will be working towards? How will you do that? But overall, in the way that we see what is being in the health sector, I think you still have more resources available, either from the budget support that is currently being enjoyed and the grants that you are enjoying. Some have actually been featured in the revised estimate because a huge donor funding that have been non-appropriated for the current year has now been appropriated. It's now being featured in the Appropriation Bill. So you have a revised figure that has gone up. But we also know that you also have a non-appropriated portion too, in the development budget of some, how much is it, members? You can help me? 65 million. Yeah, 65 million. You still have that in the non-appropriated column. I'm not sure what has happened. You might be able to give us some explanation on that, so that we can just feature them in our report. Not a big issue. Maybe next year there will be a supplementary to regularize them. If they are done in that way, great. But we want to message consistent, and that is that reporting of resources that are spent into the country has to be appropriately being appropriated, reported, and featured in our report. One of the issues that the IMF have just recently featured in one of their publications is the lack of fiscal data governance in Solomon Islands. Yeah? So we have shared that with the Ministry of Finance today, and I think they are going to find some time, to work on that. In fact, it's a very recent publication, in fiscal data governance in Solomon Islands, silo reporting, and maybe we will end up with some kind of a note from you, PS, for you to tell us how you are going to be able to respond to any reforms and improvement to be able to speed up, then participate in some efficient reporting, financial reporting, the implementation of budget and financial management. So, PS, a little bit to talk on more, but I think so far the Ministry of Health you still have a very, very stable situation in terms of resource allocation, but quite apart from the issues that we featured to you. What are your reactions to them, please? Thank you.
Thank you. Thank you, Chair of PAC and the members of PAC. We are happy to be here to present our position in terms of the current, the new budget. I will not go further to introduce myself. I think you know most of us, but I have the executive on my left, Dr. Nemia Layton, and CEO of NRH, manager for NMS, Wesley, and of course the financial controller, Jacob, and at the back is my HR manager, Gary. Now, in responding to number one, on a sudden drop of our budget, we would have loved to have an increased budget and not a sudden drop. But we also note that we have an increase of 28 million from the revised 2025 budget from 700 to 728 plus million. Now, in terms of the why it has dropped, we note that our partners are also dropping in their, are reducing their budgetary support to the ministry, but also we also note that some of the budget lines where Mifala doing this year is one-off payment that Mifala requested for from last year to this year to spend. So that was why we dropped some of the reduction, like COVID allowance. We asked for 6 million last year, but we were only given 3 million for that. So a few heads low budget line have dropped, but mainly low budget support low partners. Their support is off system and not coming on system lo Mifala. Now, Loside Law Establishment, we are grateful for the increase on our payrolls. We bidded for about 39 million, but we were only given 31 million for this budget. Now, for the to accommodate this increase, even though I am not in par with our request, the increase of our payroll is to cater for NAHA birthing facility, whereby I'm complete before middle of next year, and our CMC Comprehensive Medical Center, where we needed 130 positions to be created, and over the period by him into phases. The Naha one, we will need 45 midwives to be in place for Naha birthing, and for Kilufi, where him by complete also in June next year, we needed about 70 new positions, including nurses and doctors to be there. And also next year we'll have about 300 graduates from nurses who are completing SPP blocketa in phased approach, but we will have to absorb them Oketalo system. Now coming to MOFT, where the modeling of 80% to 20% ratio, I think for Mifalalo development budget, we have seen an increase since this year from 44 to 70 million now this year. So we are getting an increase, a huge increase. It's never before development budget, but we will hope to continue to advocate for the ratio. Now, coming to the physical governance of our finances, Mifala, we have a system in place where all divisional heads ought to report on a monthly basis in terms of the execution on the budget. Now, so this year, low recurrent budget, as of last month, we have executed 77% of the total budget for recurrent under SIG, and under donor support, budgetary support, we have executed 78%, and under our development budget to date, as of last month, we have executed 44%. So, and development budget, all payments have gone to be processed or made transferred for transaction to our suppliers. So Mifala have a system in place to report on the execution of the budget. Our challenge, or not so much of a challenge, but we are going forward to ensuring that we have a story to tell behind those numbers and figures. So as we speak now, our management and middle management of the start for our item of the progressive report locator against the money that they've executed. So there's a story behind the money that Mifala using. So, but our goal, of course, is to improve on our health outcomes and impact outcomes. Thank you, Chair.
Thank you. So, yes, when you say that, you have an increase in development budget, but that is outweighed by the
recurrent budget.
The recurrent as well, too. Good, thank you. So, in terms of the ratio expression, you've lost a little bit on that. So that's fine. So let me ask you another question. In terms of next year, what is your thinking? What would be some of the one or two significant development that you think that you will be concentrating on, in which particular area? And by the way, I haven't heard on the medical student scholarship program. Is that something that we've taken a bit of a skip on for a year, and there's nothing more for next year, or how? What's your thinking on that?
Thank you, Chair. Before I respond to that, I will respond on the other 65 billion non-appropriation.
Oh, yeah, sure.
Yeah, those are off-system and the Law Japan, Law DFAT, and the current project that is ongoing, which is off-system, using the rules and regulations to build on our behalf. Now, coming to the medical students, we have been in discussion with the Ministry of Education, with SciTESA, on medical students, because we have done our analysis also on the health workforce, which is quite critical for us. So in terms of analysis law, health workforce, we needed, as per the World Health standards, the ratio should be above 40 or something like that per 10,000 population. 40 health workers, which includes doctors, nurses, and midwives, per 10,000. But we are not there. We're less than 22 out of 10,000. So we have been in discussion with SciTESA how we can beef up health workforce training. As per our discussion with them, if I find out that there's 113 students who are currently doing medical training abroad, Western Samoa, FNU, China, Philippines, PNG, Fiji. So there's 113 medical first-year medical students, pre-service. But what we need, as per our calculations, analysis, is that we needed 58 doctors to be trained per year. So that's the discussions that we have had with the Ministry of, with SciTESA. So we will be working on a policy document to ensure that this is also scaled up, to ensure that we have those especially doctors to be trained abroad. Nurses and midwives, we can train them here at SINU. But with our doctors for pre-service, Mifala need 58 training doctors undergraduate per year to fill in the gap, because doctors are retiring, health workers are moving overseas, migrating. So we are trying to scale up on that. So our going forward for this one, we will be doing a policy discussion together with the Ministry of Education. But in terms of our reform, our legislation is key. Cabinet has just approved, endorsed our health services policy to amend or repeal or replace the Health Service Act of 1988 amendment. So one of the components of the reform is on health workforce of the Ministry of the Health sector.
So with that, it would seem to me that you haven't actually reached some kind of an understanding with Saitesa and the Ministry of Education on what the kind of space that will be given to you. And also because, this is something that has been part of our discussions in Parliament very recently, questions that have been answered by your minister. He has given the assurance that his official, which is basically you in front of us, will be taking action swiftly to talk to Saitesa and the Ministry of Education. And then now you have shown us a threshold of the kind of the level that you need to have in terms of the space training. Yeah? We want to support you. I think you should not slow down here. That's what we want to urge you, because it's so important for the health of our country. You cannot just rely on you. But one day you pull down all about nothing no more. Emotion. So why don't we take some action and get some serious discussion with Saitesa and MERD to get a space of some reasonable number to be able to guarantee what kind of training requirements that we are going to focus on forward into the future. Maybe that's the kind of impression we want to get from you. What's your view on that?
Thank
you. Yes,
yeah, just a supplementary answer on that one. In terms of postgraduate subspecialist training, so mifala karam agreement with them Saitesa finish. There's a draft MOU as well, where order giving mifala 70 spaces, and this one's for doctors and nurses and paramedics, allied health. Okay. So we'll be looking at areas of some cardiology, neurosurgery, or the high-level specialist. So a delegate was led in April this year, where Mifala identified 4 schools, universities in India, where IMISAVE utilizing. So hopefully next year we should have some doctors and nurses in India, and by Mifa review as we go. So Saitesa does give us opportunity space too. So.
Well, thank you. Thank you for giving some kind of a light into that, and I think that's a good hope for you and me going forward here. No need, Georgia. You want to ask questions?
Yes, please. Thank you, Chair. Very encouraging for hearing that if will work very hard try for address them now. Workforce need blame law health sector, and what the CEO law National Referral Hospital have tell him, that's a good proactive approach where he already identify places where the students blame say go. My question is this: what students blaming by go here? They have to come out from somewhere here, Losolo, and from secondary schools, no way. Me just like asking me, well, you all been doing any awareness like what the schools blame me to say that this is the need for motivate him or give him some encouragement for the students blame for take up such a training, or even just wait him anyone apply no more?
Yes.
Yeah, thank you so much, Honorable Dean. For us, we have not done any awareness, formal awareness, look at the schools in terms of creating the demand for the schools or students for demand for training law health side. But I'm sure there are many students out there who dream to become doctors and nurses. But on our part, we also have to create that. But it also comes back to budget, to increase the budget to finance not only undergraduates but postgraduate for specialized, because before I start for move Golo specialist areas. And there are opportunities that Mifala Savage bank on. One opportunity is with the MOU that we've done with India, but there's an upcoming MOU that Mifala like for exploring with the Philippines, because they have 405 nursing schools in the Philippines that we can also bank on.
Chair,
Yes, please.
me appreciate him respond, Blopies, but to prepare someone to take up that training, him no 1 month. Him over time. So maybe him should go to schools now. Then those out of Form 3 this time will make up their mind. Those out of Form 4, for create him now that will interest for go into medical or medical training or same. For in-service training, him easy. So ought to been lower kaya finish now. But those who are like encouraging for come up new year, I think him good for him go out. Go out for stock with him over the schools, na him. From 4, from 5, so from 6, from 7, or same.
Yeah.
You will be surprised that the numbers by him shoot up. Numbers by him shoot up. Because they know there is opportunity for training there. This time, no anyone sabe. What no sabe? They don't know how many opportunities are available for medical training offered by citation. No any students sabe. If you go tell him 100 1 year, by you look him numbers him go up. I think that approach now we need to take up, because this is an important area where we need to promote him. That's my support to this program where we like go to him. Let's not sit back and say any students like apply no more. Maybe schools should be asked to promote that kind of training for Ufala. Or the nurses or medical staff of provinces. So we go, Staka schools got him from 7 years. It's not costly. Even if it is costly, good cost, worthwhile one. Or same, No, any kind of cost all about for go visit, then come back. No, this one story. Yeah? Good story. Even if you no go to medical, it might encourage them to go into further training, but a different area. But we made an impact. Suppose we go. I think that's the message we like.
You got that point.
Yeah, thank you. We get your point, Honorable Kuku. I recall some of us who are sitting here, and probably yourselves, we've been through a system called the Careers Week, where students come together and have those opportunities available to them to go through some sort of activities. And I guess this is something to discuss with our partner, the Ministry of Education, to revisit that system.
Okay.
Thank you.
Please, my advice now is not Ministry of Education. You follow health now. You follow should go tell him story. Yeah? He must come from you follow. No ask him anyone more for go. Yeah? No go tell him different story. He must come out from the ministry now. Just send them go under secretary go laws. Waimapuru. Just story. The response will be very different. Will be very different. If that is the way we want to get the best candidates. Thank you, Chair.
Thank you. Very good point.
And the
SIU?
The other one, me like for raising, nothing to do with training. But in the recent statement came out from you, from your ministry, you will say there is an increase in HIV. DT or STI or something the same. When I look at the budget, it decrease. Why? Tell me, problem him should increase, yeah? It should increase. but him decrease now. But then we have a problem. But is decreasing that budget the way to solve the problem? Or is there any oversight no more? I'm not like for asking. Thank you, sir.
Point.
Thank you.
Respond, please.
Yeah, thank you. Before I send it to Dr. Neme, who provides that oversight to public health programs, we are concerned about the increase of HIV. The accumulated numbers now is about 70. With new cases now, it's going up to 30. So it's about 26, 29. So we are concerned about the increase of HIV. Now, the situation is only not in there are other factors that come into play with increase of drug use, illicit drug use, and also other form of activities that also influence the rise and increase. We are working closely with SIPA, Planned Parenthood Association. By Mifala work together because most of the cases that come forward wouldn't want to come through formal sector, but informal NGOs. So Mifala work through Okata. In terms of the budget, we are in discussion with DFED, and there's opportunities for quite a substantial amount of money to provide support for that region, because the story lo HIV, hem lo Fiji, lo PNG, and the same story will also occur in Solomons. But by me hand Dr. Neme.
Thank you, Chair, and also thank you, Honourable Member, for question. Yes, in terms of the Solomon's recurrent budget, yes, have no increase as we would have wanted. However, we Mifala at the moment, also as mentioned by the PS, in discussion with both our technical partners and our donor partners. So in terms of the immediate need as of this year, and probably going towards next year, Mifala managed to secure him some funding for actually for supporting the National HIV STI unit, wherefore we look for several things. One is also to increase awareness on prevention and so forth with him at-risk communities, and also with him the general population. The other one is actually to build in capacity with our technical partners based in Australia and around the region for recapacitating more at a health workforce playing not only at national level but also at provincial level as well, because our number of cases, as mentioned by the PS, is spread across the Solomon Islands. So we have to, from national level, go down doing training as well. The other thing that we also prioritize as far with the level of support, in fact, getting from our donors, believe me too, is to actually review too and actually look into our awareness campaigns and modality how we use him at the moment. For example, comparatively to how to use of social media, and also how to address and approach high-risk groups. Yeah, so those are things that Mifala work with him, Mifala ministry look like. But definitely, once Mifala gear up in terms of the response, in also reviewing our current national response, creating new policies, creating new guidelines, and so forth. That one, but we work out within PS and also our minister for also looking an increase in terms of the budget for next year. So, but as the PS mentioned him, the increase that we're having now is him from recorded cases this year. So him too also for also anticipate probably the strategies and activities, but him also change as we move forward for next year as well. So, but I think on that note, I think we for appreciate him, our donor partners from DFAT for to step in, and also our other technical partners as well. So, yeah, thank you.
Thank you. Yes, please.
Responsible and the secretary very comforting. I'm good now for you will address us them that no matter the budget will appear before us, there is a decrease, but you should show some additional funds elsewhere.
Sure.
That is a message where if you may everyone sabe, we will be by you may have himself for comfort. Yeah? Because this one, I think numbers blame me wrong. Numbers could be times 10, times or same. So it's quite a serious matter.
Yeah.
But we thank them for that proactive approach for addressing this issue. Thank you, Chair.
Thank you. Ms. Quora, you want to? Oh, sorry.
Thank you, Chair. May just like to ask a question related to the standard ratio of law, WHO, where 40 is to 10,000.
44.
44, is to 10,000. How close not you meet this time? That demands the need for you to at least increase him now. Number of.
Thank you. So the 44 per 10,000 is the standard for WHO. 44, it's all nurses, doctors, nurses, and midwives per 10,000. As in reviewing our 2024 establishment, you mean less than 22 per 10,000. So.
Share less than 22.
Yeah, less than 22.
There's an agency now.
Less than 22. So in our calculation in how many we need to train, given our scenario, we would want to have like 30 per 10,000, a moderate rate, not to 44. It may be a bit too much in terms of budgetary allocations, but 30 to 10,000 may be a good moderate rate. So that's why I mentioned about by 2031, we should have trained 407 doctors. That's giving us 58 per year. Doctors to be trained until 2031. Additional.
So how are we tracking on that? Is what you are saying that, you have been given a space of, what is it, 70, is it? So far? Or no? Currently?
Postgraduates. But we are talking about the pre-service undergraduate doctors, new doctors to be trained. So we know that there's 113 currently in various institutions, but this current student and various years too of their training. So we needed to find what exactly we needed over the next 5 years, 6 years.
So what would that mean? The next 5 years, we wouldn't be missing any space at all. We will be seeing a space of some number, training in the various field that you are.
Yeah. So.
Fill that gap. Is that what you are saying? The next 5 years, we will continue to bid for something, space for.
We would like to continue to bid for.
Say 58.
58, yes. So Ministry SciTESA is aware that we needed 58 per year.
Per year.
Per year.
Or that has to keep rolling for the next 5 years or 10 years? Is that what you are recommending?
For the next 5-6 years.
I think it's good for our secretariat to record that.
Yeah, so why we wanted by 2031 is to align to our National Strategic Health Plan, where by end law 2031. So to reach that, the closer of 2031 is the number of doctors that we wanted to be trained by 2031. So we have now 58 years. So pre-service na mifala like for beefing up. So we are in discussion with SciTESA like Mitalem, and what SciTESA has told us is that author no stop now medical training for for doctors. It's still open, but the numbers now have minimal, less than what ideally for us is at 58 per year.
Well, it's good to have some kind of a discussion on that in our report in Parliament. So it would be good to have at least some kind of a target on the on a yearly basis. And by 1 year now, we will be looking at at a minimum of some 31 or 10,000 threshold that you are or requirements that you are referring to. If we keep on with this 58 for the next 5 years.
Yeah. So if we keep up with 58 until 2031, we should have a moderate rate of 30 per 10,000. But of course, we note also that the population has grown too, yeah?
Sure.
So we take
So
note
we
of
might be
that.
running against the population too.
Yeah.
So population and go
And the cost to train 58 per year is 350 million per year. That's including their all tuition, living expenses, and everything. So it's quite a costly exercise.
Well, let's look at all these options. I mean, it's the health of our country that is important because it might cost us more than 300 million if we don't deal with it appropriately now. Yeah. So, just as what we say to education, when we talk about building up the human intelligence, capacity inside the country, that adds more value to the country. Yeah? All our investment law extractive here, if we don't manage them well, they're going to be lost in 2 or 3 years' time. But the human resource here will never lose its value. So you know, for another 1 year, PS. That's my encouragement to you. You are in that field. Those of us in a different field here, we always believe in the service sector. Now that we are faced with this kind of a situation, you will be the real investment, just like education too, and you will be able to attract more funding from our IFIs than any other. So keep on going, project it, and then target it to set an outcome. Yeah, CEO?
Yep.
That's how we should go.
Just to add, just to supplement in PS no more.
Yeah.
At the moment, we got about 212 doctors, yeah?
Right.
Yeah, so if we say 58 for 5 years, yeah, we may add them go about 270.
That's
then
about
we
500.
Yeah, we can hit about 500.
500.
Yeah. But take note too that there are also other undergraduates happen too, yeah, in China, yeah, in other,
Sure.
yeah, so.
Yeah.
I think there are bilateral arrangements that we can utilize, like with China, with Australia and others. So just plan it properly no more. But I think for every year you may come and then you ask him question, how much people in that specialization in the medical field, now you may train him here. By every year, you may ask him question. Yeah? Lock that in there, and then stay the course, and then let's move forward with it. So that's what we are going to reflect in our report here, to give you that very good support. Yes, please, Chair of Select Committee Law Health.
I have one of my relatives graduated from UPNG with medicine. He's still roaming around the street this time, and he's been here for I think almost for 2 years now. What happened to the doctors that graduate come there? Why not you follow not? How many of them are
The situation.
in that situation or on the street at the moment? We like so are they now this fella the current for Ogata or included inside too? Is there any hope for them? Yeah, so.
Thank you, Honorable Member. This year we have absorbed 35 doctors from making the transition from casual, and we're still working around the discontinuity of the terminology of casual. So 35 were absorbed into the system. CEO may give us a number on the current, but we want as much as possible to get them on board. We have an increased budget now, so we would say that there's hope that we can bring them on board, making that transition probably on a service contract and into the system.
Yeah, so
Yes, CEO.
so talk what the negotiation within public service, they will put 30 positions every year for the new ones come. Now, I don't know about your particular case, yeah. Whether I'm finished, come, then I'm apply. That one you need to find out. There are a couple of them just auto come and apply, yeah. So not come, then he must apply.
Okay. Oh, okay. Right. Okay. These are a very These are very. Let's hope that it's not a widespread situation. I think we need to take some action to look into this. These are our trained people. We spend money on them. West New Georgia, please.
Thank you, Chair. PS, this fellow, those that were sent to Cuba, where are they now in the system? And are we still sending students to Cuba? That will be my first question. The second one is in the recurrent budget, the pre-service training was reduced 6.3 million. Is there a rationale behind that?
Yes.
Yeah, thank you. Responding to the Cuba training, Cuba training has discontinued now, has stopped. And with what we have of more than 100 graduates from Cuba, they're in the system, taking up positions at NRH and out in the provinces. So they're absorbed into the system. Now, coming to training, can you repeat your question?
6.3 million reduction in pre-service training in the recurrent budget. Is there a reason for that?
You have a reduction in pre-service training.
Pre-service training.
Had
FC, you want to help?
3 at the end.
FC might help.
Yeah. Thank you for that question. Original budget for this year, I think it's 2.5, and during the year there were 300 nurses whose allowances and outstanding that are deployed all provinces. So we top up that code. That's why you look at them increase, which is shown as a revised. So once budget allocated back, I reset him back to the original allocation.
So you lost the 3.
Yes.
3.3.
Correct.
Okay, so that's the explanation. There has been a relocation of that or a transfer of that to
top it up for outstanding allowances this year.
Okay. Okay, that's good.
So,
Other question?
sorry.
Yes,
Chair.
please.
So this allowance covers the COVID and all this? So?
No, for trained nurses.
Training nurses.
Any other question?
Just the supplementary law Cuba. I think one issue where you may find him now is that for Cuba graduates for go into postgraduate specialist training, most of our regional universities here or declining yeah. So that's a big issue at the moment. But the quality of Cuba doctors, they're quite good. Yeah, they're picking up very well. Yeah.
So you mean to say that Cuba medical institutions are not accredited to our regional institutions? That's understandable.
Chair,
Yes, please.
this need blow medical for more doctors, yeah. So you give him stuck title, yeah. Need more, pressure more. Whatever name you use, you may correct everyone. Both sides. Me, Just wonder if PS, I talk with them, call it PS law for education. There is a grant from the government of Papua New Guinea, where also we give him Ministry of Education for scholarship every year. He must have a call them that one for medical training, normal law Papua New Guinea. That's done. Yeah, scholarship law Papua New Guinea, go back to Papua New Guinea. Maybe 5, 10, even not say what amount, but now it's been used for teachers. Wah saya golosino, nes, saya golosino, business, golosino. But that's a scholarship where if you have a tapum, you start now.
Sure.
Yeah, you start now. Also. And maybe if there is a grant somewhere else, you start for tapum also. I think if we put in priorities, blame me correctly, this one by all on now. But we need to talk with them.
Good suggestion.
Yeah.
I think good suggestion from non-New Georgia. We need to come up with some kind of creative thinking, and then get back to donors that have shown their generosity, Loyumi, and say to them that they've been around. I mean, they've been training our students too. I mean, we've been given the space law that too in the past. So try to talk to them. I know that Papua New Guinea has got a commitment on the MUMI on a bilateral level every year. So maybe talk to them and then possibly ask them to convince them on that kind of an arrangement. Yeah? I'm awesome. But look, you know, for us, we want to keep your funding stable. That's thinking Lomivalna. I'm awesome. And we want to assure you too that, you know, the PS Finance this morning have assured us that there is no cash flow problem, yeah?
No, my heart.
But then we are also aware that number 17 by every payment him stop. 17 of this month. Why more? Suppose him stop or it means that, you know, the month of December will be kind of a very tough road to work on, yeah. But yes, now him tell him in the morning, so we will call him back. No good me by ask for a little bit qualify more statement blow him in the morning today, but he'll be back on Tuesday or Wednesday next week. By the time we should be able to complete our inquiry. But for now, I mean, I want to ask you too one last question, no more, but because I'm running me go it low outside here. I mean, what's your thinking about, you know, the priority that you should focus on next year, or is it something that you just have to see a more balanced approach, the health sector, because you cannot prioritize him this one year to that and that year, so. Your sector, you've got to have a balance, balanced approach, yeah. So we are not going to ask you that question. But I'm going to encourage you no much. Please keep on going. But it seems that reporting, financing, health, I think you may still need for really speeding up a little bit some investment, so that we can get a good reading and good understanding along where our investment put to in the sector, yeah? But for now, Mifal Bas continue to give you all the space no more and say, look, you know, give the space to this sector, I'm saying. Only Georgia, you have one last burning issue for, yeah.
Looking at your development budget number, last year it was 44 million, yeah?
And go up.
This time having 70.
Yeah.
Okay. That 44 million, look at the projects, if all Garem Law 2025, yeah? What the project there complete everyone now? Okay, new projects more come. Add on to the existing 25 projects here. Get what I'm trying to get? what by him seems to happen is, look like by him not looking any really good something no more next year. Because at the 70, you mean share him law 2025 projects and the new 2026 projects. Yeah. That one now.
Is that how your reading is?
Yeah.
If you said everyone complete, said this 70 is for these new projects. But I think if I get you right, PS, last time, you say continuing, time you appear lawyer too. You say, these are continuing projects. And no completed, yeah. So for completing, no come this time, yeah. But them sample a new one more. So, one no more so. Maybe prioritize him. No more of a new one, yeah. Yeah. So tell me, look him complete. No go tell me groundbreaking law there, go groundbreaking law there. Groundbreaking no more budget, yeah. So that one also little bit, not only you for, but also everyone every. Also.
But your
Thank you, Honorable John Dean. We have an increase to 70 from 44. Like I said last year, the 6 existing one was carried forward from 2024 to 2025. These 6 are completed, the 6. As we speak, Dedeu and Konide have been officially opened yesterday and today. There's Wagena, Leona, Tukutanga, and Kwantai that will be opened soon. So the 6 are completed. Now, we have 10 new for our rural health clinics and 10 new for area health centers. So there's an increase under the primary health care. But also the secondary health care, Mifala increased too, to refurbish and refurbish some existing facilities, including Sege, and Malu, Lata Hospital, and Taro, which we have been back and forth with finding a potential funding source, but we were not able to. So that's why Mifala including into the development budget. Now, as you will note, there is a new program for National Public Health Laboratory. This is new program because of the trade connection for testing of the goods for export. So that's a new program.
So where will that be located, here in Honiara or elsewhere?
It's expanding the existing national laboratory,
Over here.
public health laboratory.
Is that okay? Any other issues from anyone? Well, PS, we've done well. I want to continue to encourage your team. This committee will always support this sector, and we want you to be given that consistency in the way that you are treated with the resource allocation, so that we can make a difference. I think our people right at the center have taken heed of some of the advices that we've given, and I'm really pleased that you've got a good boost in your development budget allocation this year. But of course, the recurrent will continue to rise, so that has actually offset the ratio way on the distribution of the resources. But that's nevertheless, that's a way to go. Some of the manpower requirements here, we continue to urge you to keep that momentum going. Keep your beat at that level, and I'm sure that we can make some progress going forward into the future. But for now, thank you so much for appearing before the committee. We really appreciate and impress on the contribution and the engagements that we have had. Thank you so much. With that, members of the committee will now adjourn until tomorrow morning. Thank you.